A 24-year-old university graduate walks into A&E unable to breathe. The paramedics suggest she's just having a panic attack and overreacting. A nurse hands her an oxygen mask, but it's not connected to any oxygen. She's left to wait in the corridors of the hospital, and within hours, she's gone. This happened to Clarissa Street in August of 2024 at Royal Oldham Hospital. A coroner later said that she had a 50% chance of surviving if she had been given proper, timely care. Why was a young woman with clear breathing difficulties dismissed so quickly? Clarissa was creative, talented, outgoing, and a sociology graduate from the University of Manchester. She earned the Dean's Awards for a dissertation on a powerful topic exploring working class culture. Her friends and family describe her as very well liked, someone who lit up rooms, loved going to concerts, and just cherished time with the people around her. But she had a medical history that mattered. So back in 2017, at just 17, she suffered a provoked pulmonary embolism and deep vein thrombosis. She'd been on blood thinners at times since then. So on the evening of August 13th, 2024, after 2 days of feeling unwell with dizziness and breathing difficulties, her boyfriend called an ambulance. She arrived at the Royal Oldham Hospital's A&E at around 11:25 p.m. Here's where things went terribly wrong. Paramedics reportedly told the triage staff that she was just having a panic attack and was overreacting. So that was failure number one. Then one of the nurses gave her an oxygen mask to try and regulate her breathing, but it wasn't connected to any supply. She was then placed in a corridor and left there for over an hour. Her oxygen levels were low, her heart rate was high, yet the initial management was delayed. So by the time she was finally moved to higher care, her condition had worsened, and it continued to worsen. She suffered a cardiac arrest and died in the early hours of August 14th. The official cause: massive pulmonary embolism with a background of fatty liver disease. This is so incredibly frustrating. You have someone come in with breathing difficulties, with a history of clotting. Why was this not treated more urgently? The inquest at Rochdale Coroner's Court in May 2026 exposed serious basic care failings. The coroner highlighted problems with triage and initial management. While not rising to legal neglect, these were contributing factors. Expert evidence showed that Clarissa would have had more than a 50% chance of survival if she was only given the proper care that she should have gotten in A&E. These weren't mistakes. They were failings in listening, basic monitoring, and acting on red flags. Failures that happen far too often when the patient is a young woman. This isn't just one hospital. So let's look at the wider pattern that makes cases like Clarissa's tragically predictable. Women wait longer in emergency rooms for the same complaints. Studies show women receive less pain relief, and the symptoms are more often psychologized as anxiety or stress. For pulmonary embolism, which is a killer that can strike young people, classic symptoms like shortness of breath are sometimes dismissed in women. Heart disease, the number one killer of women, sees women 50% more likely to be misdiagnosed during a heart attack because of the symptoms. Fatigue, nausea, jaw pain, back pain. They don't match the male chest clutching version taught in textbooks for decades. 1 in 4 women report these symptoms being dismissed. Young women and women of colour face compounded risks. Have one of you guys, or maybe someone you know, left a doctor's office feeling dismissed, feeling ignored? I thankfully have not, but I know some people who have, and they are absolute horror stories. It blows my mind that doctors can be like that.
And here's the deeper issue. Medicine was built assuming the male body as default. Until the early 1990s, women were largely excluded from clinical trials due to concerns over hormones and pregnancy. Even now, women are underrepresented in many studies. Female animals and cells are often excluded in early research because hormonal cycles are seen as messy. And the results? Women suffer adverse drug reactions at about twice the rate of men. Even devices like hip implants fail more in women.
Heart disease diagnostics and treatment lag. Conditions like endometriosis take on average 7 to 10 years to diagnose. Menopause, menstrual impact, autoimmune diseases, which largely affect women, they remain underfunded. This knowledge gap directly harms patients like Clarissa. So how can we fix this? Mandatory sex and gender analysis in all research and trials. Better medical education on sex differences in disease presentation. Increased funding for women's health research. Stronger accountability and learning from inquests like Clarissa's. Support groups like women's heart health organisations, endometriosis advocates, research campaigns, and share stories like this one. Clarissa's family said they hope things can change, that her death must not be in vain. Clarissa's life mattered, and her story needs to be told. So please share this, get her name out there, get her story out there, and we can make a change together. Like if you want, subscribe if you want, comment down below, and share. That's the most important thing. Stay informed, advocate harder, take care of each other. Now we'll see you in the next one. Ta-da!